When I was in my younger years, I think I was probably in elementary or high school, my paternal grandmother had a hemorrhagic stroke. And I just couldn't fathom at that young age why she had to be let go. It drove me as to like, I needed to understand why and like how come that was the end point. You know, when you treat a patient, you're not just treating the patient, you're also treating the family, especially if it's something more chronic and more grave in prognosis. Patients who, for example, have dementia, I mean, you cannot get so much from them. You have to rely on the family, and they're going to be your eyes, they're going to be your ears, they're going to be the ones reporting as to what progress is happening or, you know, how the patient is doing. I have a patient who I've seen ever since I started practice. And every time he comes, we talk about his family and we talk about his wife. And every time there's a special occasion in the family, I get invited. I myself, I feel very privileged to be practicing in the city where I live in. You know, number one, it's convenient, yet at the same time, you see these patients everywhere. You go to a place, you see them there, you know, so it's familiar places and they recognize you. Number two, the fact that we're part of the clinic and we're still practicing and we're reaching out to the community, I think the patients have a very, very good benefit from that. You know, aside from we rendering the service, if it's complicated or if we don't have that service, we always have that backup. We always have, you know, it's a phone call away to call main campus to ask for help or to get services that we don't offer there. So it's always a big plus for the patient.